Welcome to Change in Condition, Recognition, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for patients, anyone providing care to an older adult in any caregiving capacity, and even those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding of how to recognize a change in condition. Superior Health aims to empower you by increasing your confidence with making the right decisions, knowing when to tell someone what you see, and the ability to recognize a change in condition. The purpose of this course is to further your learning and application of these skills to real-life situations. This learning module, Change in Condition, is a 4-part series. You are viewing the first of the series, Change in Condition, Recognition, which provides an overview of why it is important to recognize change and how to recognize the common reasons a person may be showing a change in condition. This module has 3 additional sections in the series. The second part gives guidance on how to effectively communicate a change. The third demonstrates how to communicate change using evidence-based tools. And finally, the 4th part of the series is a review of a case study. It is not necessary to complete the entire series in one sitting. You can leave and return to the course at any time. Key points this module will review include: it is essential to notice and report changes in a patient's condition. This is everyone's responsibility to do so. Watch for signs of illness in older adults and patients. Know what to watch for and report changes in a patient's condition. Detecting change is important. A change in a patient's condition may mean that he or she is at an increased health risk. Action can be taken only if changes are noticed and reported. The earlier, the better. Changes that are not reported can lead to serious outcomes, including medical complications, transfer to a hospital, or even death. To recognize a change in condition, first you must recognize what is normal, or know the baseline of that particular person. This module will provide an overview of the top 12 changes to watch for, how to document, and how to communicate the change. After completing this module, you will be able to summarize a patient's normal or baseline condition to confidently communicate to other team members. Identify whether changes in a patient's condition are important or not important, and have the skills to promote behaviors that improve change detection. Why is detecting change important? How do you know if this is the patient's normal behavior or baseline condition? How do you know when or if you should be watching for a change? When should what you are seeing be communicated? How do you communicate the change, and what do you communicate about the change? These questions and more will be addressed during this module. The Agency for Healthcare Research and Quality, or AHRQ, provides this case study. Let's meet Arlene. Arlene is a mentally intact 79-year-old frail, or in a weakened condition, woman who arrived at the Manor Nursing Center after a hip fracture at home. After a stay in an acute rehabilitation center, she is still not able to manage by herself. Arlene walks with difficulty with a walker and needs help with her daily living activities. Arlene also has several other medical problems. She has high blood pressure, diabetes, and arthritis. She is also being treated for depression. Her family visits her regularly on the weekends. She rarely participates in activities of the Manor Nursing Center. At mealtimes, she tends to avoid conversation. Recently, she had diarrhea, was incontinent of liquid stool, and was placed in adult briefs, and nursing assistants had to change her adult briefs once or twice per shift. Arlene began taking her meals in her room. Stool tests showed that she had a bowel infection with Clostridium difficile, or C. diff. An antibiotic was started. Even with the antibiotic, Her bowel movements continued to be liquid and frequent over the next week, and she was eating less. Her blood pressure had been normal for her at about 130/80, but her pulse rate was higher than her usual 70 to 75 and was now about 90 to 100. Yesterday, she had a fever of 102.5 and was transferred to the acute hospital, where she was admitted to the intensive care unit. Did you notice any changes that may be taking place in Arlene's story? And what are some of the changes you observed? Arlene recently began taking meals in her room and eating less. She has developed diarrhea for a week and was incontinent of liquid stool. She requires Depends and tested positive for a bowel infection. Also, her vital signs have changed. Her pulse is now 10 to 30 beats per minute higher than her normal pulse rate, and she developed a high fever of 102.5. Are there other important details to remain aware of? Arlene is 79 years old. She is frail and weak. Although in the recent past she was living at home, Arlene has not fully recovered from a hip fracture that happened in her home. She is still not able to manage by herself after an acute rehabilitation stay. She walks with difficulty. Arlene also has other conditions. She has diabetes, high blood pressure, and arthritis. She is becoming isolated, avoiding conversation, and is being treated for depression. Think of yourself. When might you tell someone about the changes you observed? Have you ever felt like you were in a difficult situation that could have been avoided if you noticed the change in condition earlier or communicated it sooner before it got worse? Arlene's story is a situation that can happen when a person is ill or weak or frail, just like Arlene. When one thing goes wrong, it seems to lead to another thing going wrong, and that can continue until a person becomes very weak and very ill. Noticing changes, no matter how small or how big, can be important in stopping the chain of events that can lead to a serious problem or a serious change in condition. The sooner the change of condition is noticed and communicated, the sooner someone like Arlene can be attended to, and the better the outcome can be. What is an example of a warning sign that Arlene was becoming more ill? Is it her eating less? Is it her diarrhea that has lasted all week? At what point would you think that diarrhea might be a symptom of something more serious? The fact that she tested positive for a bowel infection, and what about her change in pulse and fever? Who could you share these concerns with? Do you think this situation could have been prevented from happening? Patients in all care settings are in a vulnerable situation. When they are somewhere like home, where they are surrounded by people who know them, a family member or a friend may notice a change in their behavior, indicating a change in condition, and they are more likely to call the doctor soon after noticing the change. Also, if a person is in the hospital, a nurse, doctor, or others may be in and out of the patient's room most of the day and are trained to notice sensitive changes in the patient's condition. However, in a long-term care environment, doctors, nurses, and family members are around much less frequently. The person who sees and interacts with the patient the most is the nursing assistant. As caregivers, your role is very important. At home, people know each other well and notice changes in a friend or family member's condition or behavior. In a hospital or clinic, registered nurses, nurse practitioners, and doctors are there almost all of the time, and they are trained to look for signs of illness and to be sensitive to the changes in a patient. In nursing centers and other types of long-term care, nurse practitioners and doctors are there for much less time. The providers who most often see the patients are the nursing assistants, and the ones who see them some of the time are occupational therapy, physical therapy, and the licensed nurses. Unit administrators, clerks, and volunteers may also be there. Patients in long-term nursing centers depend on nursing assistants and these other providers to be the ones who notice the change. Caregivers become the eyes, ears, and hands of the care team. Patients depend on you to be alert and interested. They depend on you to talk with your team members so everyone is tuned in. They also expect you to respond if something comes up. Caregivers are very busy and have many tasks, but detecting change is one of the most important. Leaders and advocates in care settings believe that having the same staff consistently assigned to the same patients leads to better care for the patients and higher staff satisfaction. Having consistent assignments is more likely to work when leadership educates staff on the benefits of consistent assignments. All members of the team participate in meetings about consistent assignments. There is a process to ensure caregivers have input when assignments are given, with the goal of having everyone feel that their assignments are fair. Care team members meet regularly to discuss how the consistent assignment is working, including reviewing assignments to ensure that relationships with the patients are going well, and when leadership invites suggestions from team members about improvements. Know the patient's normal baseline condition. When you first meet patients you're responsible for, you should talk with other members of your team to find out everything you can about the patients. Your coworkers may have learned things you need to know from other care providers or from family members and visitors. This can help you establish what's normal and may be called baseline information. To stay with each new patient as long as possible, just getting to know him or her, so that changes don't get overlooked because you don't have enough baseline information. Establish a conversational relationship with the patient and family, and stay in touch every day you are with the patient so that you are more tuned in to how he or she normally is and how long he or she has been at that baseline. A change of shift report is another good way to gather baseline information. Be sure to note a patient's ability to move around, their usual method for getting from, say, the bed to the chair, and how they do with activities of daily living. For example, do they need to sit while they are in the shower? It helps to know their preferences for activities, eating, dressing, and other things. Changes from baseline in the patient's routine or enjoyable parts of their day can signal a medical change. In addition, be aware of the patient who seems to be uncomfortable. Many older adults will not be willing to talk about pain or discomfort unless you ask them about their pain. When you learn these important things about patients, make sure that you share the information with your coworkers. Some care providers, such as a float nurse or a new hire, doesn't know all they need to about the patient. Help them out by sharing relevant information and tips. When something about a patient seems to have changed, you should always observe and document the following things. Look back at the previous shift notes and make a shift-to-shift comparison. Make sure that needed equipment is available: the blood pressure cuff and stethoscope, the pulse oximeter, and the thermometer. See if a change occurred in any of the patient's vital signs: blood pressure, pulse rate, breathing rate, or temperature. Check the patient's urination and bowel movement records. A quick check by the licensed nurse of the patient's bladder with a physical examination, percussing or tapping over the bladder area to see if it sounds like it is full, or with an ultrasound if one is available, can be very helpful for the patient who has not urinated and may need a catheter. If your nursing center has a handheld ultrasound, make sure it is present too. When you have collected all of the information you can, be sure to share it with a licensed nurse. The registered nurse may then decide to do a full assessment by reviewing the patient's condition to see if a different treatment is required. Gather additional information about the patient before reporting to the licensed nurse. Ask the patient how they feel, when their symptoms began, and complete a set of vital signs. When you have collected all of the information you can, promptly share your information in an organized manner with the licensed nurse. How is the role of the licensed nurse different from your role? Registered nurses should follow prior training when conducting an assessment. This module will not address in detail how registered nurses should assess change. However, briefly, the registered nurse will do the following. Ask the patient how he or she feels, even if the patient is confused or seems to be out of it. Ask the patient how the symptoms began and when. Take the patient's vital signs again. Perform a general exam and assessment of the patient's level of consciousness or cognitive function and physical function, following the usual methods for patient assessment. When the assessment is completed, the registered nurse will organize this information to report the change to the patient's nurse practitioner or doctor, if this is necessary. Because older people may have a serious illness and the only sign of illness is some confusion, assessment of confusion is important. There are several tools to help with evaluating changes in mental status, including the Brief Interview for Mental Status, BIMS, which evaluates the normal baseline mental function, the Modified Confusion Assessment Method, CAM, which is a simple set of questions that helps to identify the presence of confusion, and the PHQ-9, which detects changes in mood such as depression or anxiety. Knowing how to administer each of these instruments is part of the licensed nurse's scope of work and may help to identify changes in mental function that could be a sign of a serious illness. What is important for the caregiver is to report to the nurse if you notice a change in behavior, such as no longer having conversations with you, becoming more withdrawn, or acting confused, to name a few. It's a challenge for caregivers and licensed nurses to notice changes that matter, because so many things might matter. We all know from our own lives, it can be hard to know when to react to a possible concern. For example, on the one hand, sometimes we worry too soon that a second sneeze might be a sign of a cold, and on the other hand, sometimes we ignore a bad cough for too long and get sinusitis or even pneumonia. The signs and symptoms of illness in older adults may be mild or different than in younger people. Older people have a slower response time and less response to change. Sometimes mild symptoms and behaviors like feeling or acting tired are the only clue to an illness in an older person. In a younger person, the same illness would cause a fever or something more recognizable. So it is important to notice and report changes in an older patient sooner than you would for a younger person. The key to watching for change is to always be watching. This is hard to do. No one can be perfectly aware all of the time, but if we have a good baseline for what is normal, it is also almost automatic to notice a change. Try to watch patients wherever they are, not just during specific times or in specific places, such as during medication hour, but try to watch them as much of the time as possible. The more comfortable and familiar the relationship with the patient is, the easier it will be to recognize change. Check in with the patients often. Ask how they are and watch them during their daily living activities. Take special care with patients with dementia to get to know their baseline and watch them because changes for these patients can be sudden and they may not be able to tell you what's wrong. Always check with others who provide care for your patients. When you see what might be a change, it is especially important to talk with your team members and see if they've noticed a change as well and when they think it may have started. There are physical and non-physical changes you may notice. Watch for these physical changes. Walking. If the patient needs assistance, watch how much assistance do they need with walking. You may notice the patient has trouble getting started or poor balance. They may seem to take smaller steps, shuffling steps, or walk with the feet wide apart. The patient may favor one side more than another. These kinds of changes put the patient at risk of falling and may also signal an underlying problem. Urination and bowel patterns. Be sure to notice if the patient is incontinent of urine or stool, or if urination is more frequent, if the urine smells different, or if bowel movements are rare or change to diarrhea. Skin. It is very important to notice and report skin changes. While bathing and dressing the patient, look to see if the patient's skin is discolored or puffy. Reddened or darkened skin near a pressure point or skin breakdown in those areas can lead to a full pressure ulcer injury or bed sore if it is not responded to promptly. Level of weakness. Is the patient having difficulty lifting his or her arm? Weakness can be a symptom of many kinds of illnesses. It can be general weakness, like all over the body and a feeling of fatigue, or local, which is just in one area of the body. Small changes in level of weakness that are different from the baseline pattern should be noted and followed up on. Falls. Is the patient at risk for falling? Watch the patient for loss of balance or being unsteady. Observe the patient walk, transfer to and from chairs, and as they reach for objects when in a wheelchair. There are many things that can cause a fall, including things in the environment, like lighting, slippery floors, or objects in the way, and things about the person who fell, like medications, medical conditions, and their state of mind. Because falls often involve many factors, they should always be reported to determine what changes can be made to keep the patient safe. And vital signs. Record the patient's blood pressure and heart rate, and look for any changes in breathing and temperature. Is the patient breathing faster than normal? Or has a change in blood pressure, pulse rate, or temperature been noticed? When there is suspicion of a clinical change, vital signs must be obtained and should always be compared to the baseline vital signs. In addition to the physical changes, you should watch for these non-physical changes. Many of the non-physical changes described here may be present when a patient has delirium. Delirium is confusion that comes on suddenly and is related to another condition. Delirium can result in increased activity, hyperactivity, or decreased activity, hypoactivity. Demeanor is the appearance or way someone is acting. Observe the patient to see if they socialize less or participate in activities less than usual. Illness can affect a person's mood or behavior by changing the way their brain works. A patient may become more withdrawn or passive, or not want to get out of bed, not want to socialize with others, or participate in their usual activities. They may not be as talkative or may seem to be inattentive. Appetite. Observe the patient during meals and their tray after meals to see if the patient is not interested in their food. Changes in appetite may signify many conditions and should always be reported. Sleeping. Does the patient fall asleep in unusual places? Poor sleep is a problem for everyone, and patients deserve an assessment to allow them good sleep, if at all possible. Changes to watch for include the patient complaining about not feeling rested, falling asleep in unusual settings, and being hard to rouse from sleep. Speech. Talk to the patient to see if speech is slurred. Speech problems are noted when patients have newly slurred or garbled speech, problems speaking loudly enough, or problems with chewing or swallowing food. Sometimes they may have problems finding the right words to say. Confusion or agitation. Watch the patient for new fidgeting. When approaching the patient to give normal care, ask the patient structured questions to see if they talk more or less. Older people living in long-term nursing centers are often confused at baseline, but new levels of confusion or delirium can mean many things. Changes to watch for include behaviors such as talking a lot more, or talking less than usual, talking loudly, or talking in ways that don't make sense, as well as refusing or resisting care. Some patients with confusion see or hear things or people that are not there. Patient complaints of pain. Does the patient grimace or wince when moving? Patients know their own body sensations. It may be hard for them to convey that something new is happening or something has gotten worse, but even patients with dementia may be able to express something. Listen to the patient to see if he or she can tell you more about what hurts or feels different or is bothering them. The ability to detect change in a patient's condition is important because it can prevent illness from getting worse. Caregivers know the patient best. Therefore, they are the best qualified to notice when there is a change in a patient's condition. Detecting change depends on all caregivers being alert to changes and ready to share their observations and respond to the changes. In order to properly assess change, it is necessary to know the patient's normal baseline condition, assess the change and compare it with the baseline, and know which changes might be signs of illness. When there is a change in condition in an older person, it is usually less obvious than it would be in a younger person, and it could mean many different things. Changes to watch for include those affecting the way a patient walks, urinates, their bowel patterns, skin changes, level of weakness, falls, vital signs, demeanor, appetite, sleeping, speech, confusion or agitation, and patient complaints of pain. It is now time to test your knowledge. Click the link for the Change of Condition Recognition quiz on the Frontline Forces webpage or in the YouTube description below.